Well, welcome to the Aging Boomers. I'm your host, Frank Sampson. Of course, on our show, we discuss so many of the issues facing boomers, their parents, and what we know, of course, is an aging population. I just want to thank everybody for joining us today, and thank you for all of those that have downloaded our shows, listened to them on iTunes, iHeartRadio, or on your app, on the Aging Boomers app, on your iPhone or Android phone. So many different ways to connect and listen to all the people that we are interviewing in the healthcare, senior services, memory care, all the things that authors. We interview a lot of different people on the show, and so I just want to thank you all for your support. Also, I want to thank you, as many of you know, I came out recently with my new book that's also called The Aging Boomers, and we're getting a lot of people that are ordering the book, and I think it's a great education for people, especially those that are either taking care of or maybe taking care of a spouse or another loved one. So feel free to go to Amazon and learn more about that. Today's show, of course, is sponsored by Senior Care Authority, a professional senior placement and elder care consulting organization that has a national network of advisors to help in determining the right path for senior living and receiving proper care. Even if you need an advocate, Senior Care Authority has people around the country to help. So whether it's in-home care, assisted living, residential, or memory care, get the necessary advice from a senior care advisor in your area by calling Senior Care Authority at 888-809-1231, or you could go directly to the website at www.seniorcareauthority.com. I'm always excited about our guests, but we got a wonderful guest today to talk about Alzheimer's and brain awareness. We have with us Deborah Richman, who is the Vice President, Education and Outreach for the Alzheimer's Association in Minnesota, covering Minnesota and North Dakota. She is certified as an activity consultant educator with the National Certification Council of Activity Professionals and is certified by the Alzheimer's Association to offer foundations of dementia care. She has worked with with National Alzheimer's Association to develop training programs for community education volunteers and has also provided independent consulting and training in the areas of communication and memory loss, dementia-related behaviors, and therapeutic program development, as well as training for direct care staff in residential care facilities on providing person-focused activities to enhance quality of life. Outside of the education and training, Debbie has assists in research, doing clinical observations as a project consultant for Healthcare Interactive Incorporated. Debbie, first of all, welcome to the show. Second of all, how have you even had time to even be on this show with doing all of that?
Well, thank you so much. I appreciate the invitation to be here. That's a very long description of a career that's now almost 30 years old, so wow. I don't do all of that at once.
Yeah. Well, that's great, and we're thrilled to have you on, and I know people could be listening to this interview and podcast for the years to come, but we just happen to be in the month of June right now, and which is Alzheimer's and Brain Awareness Month. So tell us a little bit more about what that is and what the Alzheimer's Association is doing to help spread awareness.
Well, the entire month of June is really dedicated to the country in a lot of ways to try to help the country understand and appreciate the need for concern around Alzheimer's disease and other dementias. Surprisingly, people may be surprised to know that Alzheimer's disease has been around since 1906, and we still have a society that is very unaware and in a lot of ways uneducated about the disease, what it does, what it doesn't do, who's at risk, and what the resources are available. So the Alzheimer's Association has designated this entire month to work very hard to give that information to people in an assortment of different ways, even just awareness around the color purple, and that is the association's color, helping people understand that it's more than just a problem with memory, that it's not a normal part of aging. People should get diagnosed. All of these things that, for me in my daily work, I don't understand why people wouldn't understand, but the reality is that there's still a huge amount of education and awareness that needs to be done in the community. So we designate the month of June to do that and really try to increase awareness of the disease and what's available to help support not only those living with a diagnosis, but those taking care of them.
So what can our listeners do to help with that? I mean, social media. I mean, what can we do to help?
Learn.
Okay.
I think the biggest thing is today. There's people don't want to deal with this disease because people think that it's not going to happen to them. I'm not going to deal with this problem in my lifetime, and the unfortunate reality is you probably will. We talk a lot at our organization that everybody that has a brain is at risk, which means everybody. And people need to really start to pay attention and understand that they need to have an awareness. They may not have an immediate concern. It may not be immediately in your family, but there needs to be an awareness and an understanding of this disease. Social media is a great way to learn. We're on Facebook. We're on Twitter. Some chapters are already on Instagram. We're going to be on Instagram soon, looking at having our event information, ways for people to get involved, to help us raise funds. But even just talking about it, even wearing a little bit of purple this month, and doing that in honor of the fact that there are people in every community, every place in this country living with this disease or caring for someone with this disease, and we need to start realizing that there should be no stigma about this anymore. We're all dealing with it, or we're all going to deal with it, and the sooner we have that realization, the more effective our organization can be, and the more ground we're going to gain in terms of cure or delay or even more effective treatments. So that's what people can do.
Great. So help educate us a little bit here. I mean, I know the organization is called the Alzheimer's Association, all right? And you just do tremendous things. It's not called the Dementia Association. It's called the Alzheimer's, which is a type of dementia, and we've talked about that, on our show, but we can't talk about it enough. So help us understand really more the support the Alzheimer's Association gives to people who are affected not only by Alzheimer's, but it could be other forms of dementia as well, and maybe explain the difference if you can.
Right, and thank you so much even for bringing that up. Although the big letters of our name are the Alzheimer's Association, we are also other dementias. Alzheimer's disease is the most common, and I think sometimes people confuse that Alzheimer's and dementia are the same thing. They're used as synonyms. And really, dementia is that overarching term that implies a loss of memory and intellectual function that makes it difficult for people to do what they need to do on a daily basis. But there are upwards of 50 different conditions that will have dementia as a symptom. So dementia by itself doesn't really happen. It happens in conjunction with something else, some of which are treatable, some of which are not. And so although Alzheimer's is probably the one we hear the most about, there are others. And our organization can assist people with any of those types of dementias, whether that's basic information, whether that's support groups, whether that's care consultation. We help people with planning, whether that's our 1-800 number. We have a 24/7 helpline, which is really a hidden gem. In any state in the country, they can call that 1-800 number and talk to somebody either at our national location in Chicago, Illinois, or they will get somebody at the chapter level. And it's 24 hours a day, 7 days a week. And one of the things we know about this disease, regardless of what type of dementia, is it's a 36-hour day. There's a wonderful book that was written many years ago that is still that go-to book where caregiving never stops. And people are going to need resources and support all times of the day or night. So it's a great way for them to access what they might need truly whenever they need it. So that's a lot of what we do, in addition to raising money to help with research. I think our main mission is to have a world without this disease. I would love for that to be the reason that I don't have a job, is if we didn't have the disease anymore. We're not there yet, but the more we make people aware and we educate and people help us raise funds for research, we're making a lot of progress. We're gaining ground financially in terms of the amount of money we need, but we're not where we need to be yet. So we need to still work a little bit harder to get there.
You mentioned the 800 number. Could you share with us that number? We'll ask again before we sign off at the end, but it doesn't hurt to mention it again now.
I would love to give you that number, and it's 1-800-272-3900.
Okay, great.
And
great.
Anybody can call that number from anywhere.
Okay, good. So, you mentioned that, I've had scientists on the show, researchers, and unfortunately, they're saying that the emphasis is on trying to help people help to prevent getting the disease. There's more emphasis on that than trying to, cure it once somebody gets it. Because that's a much bigger challenge. If you've heard differently than that, boy, we would want to know about it. But that's what I hear. All right. So obviously, people, educating themselves, eating right, exercise, all of the things that go with it to help prevent from getting it. That seems to be the emphasis. Would you agree with that?
Yeah, that's really the big direction of the majority of the research. Some of the more significant studies are certainly looking at prevention. But the opposite side to that, maybe opposite side, is that there's also an element of research looking at, could we delay the onset or could we slow it down a little bit if it's already started? Mm-hmm. The reality of a cure, and not that a cure would be a bad thing, I don't think people would be upset if we found a way to cure it, is at what point are we able to cure it? Because people that are already symptomatic or already well advanced into the disease are probably not going to benefit from the cure. So when we talk about prevention, is there a way that we can do something, whether that's lifestyle modification, so you referenced, eating right and exercise and those sorts of things. Is there a way with lifestyle modification to truly prevent, or could we delay the onset so that if right now we're seeing approximately 1 in 3 over the age of 85. If we could delay the onset by 10 years, even by 5 years, we know that would have significant impact not only on the economy, but on the need for longer-term care. The older you get, the less time potentially you're going to have to deal with the disease, which I apologize, sounds kind of awful. But if we could delay it, that would have some impact. So we're seeing kind of both sides to that coin. But you're right, when you talk about cure, this is one of those diseases that, because of what we know about the brain as well as what we don't know, we can't create new brain tissue. So once the brain is damaged, it's damaged. And that's, I think, the crux of the challenge of do we put the emphasis on cure, or do we try to figure out a way that we don't have to deal with it at all, that we could potentially eradicate it from ever happening again? So what you're hearing is pretty consistent with what we're seeing in the research community as well, and where we're seeing the emphasis.
There's, as you know, I'm in the business itself, and there's a statistic that I do share with people that I think it will really send a strong message of how serious this disease is. In comparing deaths, people that die from Alzheimer's, compared to other diseases and what's happened over the years. You want to kind of share with our listeners a little bit more about that statistic?
Yeah, since the year 2000, we've been collecting data about the number of people that die annually from related conditions, and we've seen declines in rates of death around, even breast cancer. I know when I when I talk publicly, I'm always amazed by the statistic that we've actually seen a 2% reduction in deaths related to breast cancer, because frankly, I don't know that I ever expected to say that out loud. You know, as pervasive as breast cancer is, it sounds sometimes like it's getting worse, and the reality is we're seeing some evolution with breast cancer. We're seeing reductions in deaths related to prostate cancer, heart disease, stroke. We've seen a 52% reduction in deaths related to HIV and AIDS. And I'm of an age myself that I remember when this hit, and, you know, it was declared a public health crisis, and there was a giant infusion of money and research to develop medications that are now used today in various cocktails. So people that get that diagnosis are able to really live a fairly high quality of life on these medications and live into old age, which is impressive, really. But simultaneous with that, we have seen a 71% increase in the number of deaths related to Alzheimer's disease. So we are unfortunately on the wrong side of that line. Our numbers are going up. And as the population continues to age, and those of us that are baby boomers are right smack in the middle of that problem, because as we start to turn 65, and I believe I heard the statistic the other day that there's 10,000 baby boomers every day that turn 65.
Correct.
Yeah. And so you start just looking at those numbers, and 1 in 9 over the age of 65, 1 in 3 over the age of 85. If you looked at no other factors but that, the numbers are going to be staggering very soon if we don't figure out a way to manage this disease. And programs like this are fabulous, but there's not enough of them. We don't talk about it enough. We don't have water cooler conversations or lunch conversations or people on talk shows with enough consistency that it's a commonplace conversation. And that's where we need this to be, not only on the community level, but on the government level. The government needs to be talking about it too, because they're not immune. And I will say that in the last couple of years, we've seen some tremendous momentum with additional research funding that has been either already given or is potentially going to be given this year to Alzheimer's disease, and a heightened awareness around care and support for caregivers. But meanwhile, we still have the underlying problem, and we have 5.4 million people living with this disease. Those numbers are going to go up, and we have to figure something out to manage this problem.
I think I know the answer to this question, but I'm going to ask it anyway. And I think probably our listeners may even know, but I'm going to ask it anyway. Do you think our country's ready for what's to come?
Absolutely not.
Yeah.
I wish there was a different answer. I think some states, some communities are starting to maybe realize that they're not ready. Minnesota, as an example, has an initiative called Act on Alzheimer's, which is a statewide collaborative to make the entire state more dementia-friendly, to increase awareness in communities across the state about how to help people in those communities that are living with the disease. This has now given birth to something called Dementia Friendly America, where we're looking at a nationwide initiative, but it is just the surface of what we need to be doing, because being more aware and accepting of people in the community is one thing. Now we have to figure out how we're going to manage those folks, for example, if they can't be living at home anymore. Where are they going to live? Who's going to take care of them? How are they going to afford that? It's an expensive disease, and it's not going to get any cheaper. And the generational shift that's happening with saving money, or not saving money, if you will, these individuals are going to need more assistance than they ever have before to pay for that care. And Dr. Ron Peterson, who is the head of the Alzheimer's Disease Research Center at Mayo Clinic, has been quoted on more than one occasion as saying that if we don't do something, this disease in and of itself has the potential to bankrupt the healthcare system.
Right. Yeah.
So we're not ready.
Yeah, it's scary stuff. As you know, I mean, I've been in the business and I've worked with families whose loved ones were professors, scientists. I mean, these are the people that get it, as well as all income levels. I mean, it affects everybody. Everybody. It's no one's immune to this. However, there are certain categories, like women. 2/3 of Americans with Alzheimer's disease are women. So tell us a little bit more about that, and maybe certain areas that maybe are more, I don't know, that have a greater chance of getting it than others. What are the statistics there?
So the statistic around women is women are actually twice as likely as men to develop the disease, but women are also 2/3 of the caregivers. So in some cases, you have the woman who is taking care of perhaps an aging parent or a spouse and then ends up with the diagnosis herself. And there's a couple of things that we know around why there's more women. One would be the fact that the life expectancy of women is still slightly longer, although that's not a significant factor. We also know that men between the ages of 45 and 65 are more likely to have issues around cardiovascular disease, so the number of men that is sort of eligible, if you will, for dementia drops a little bit. And so we see kind of that shift. So it's not like women live twice as longer, so that stat gets a little bit confusing. And the estimate right now is that of that, so when we look at 5.4 million in the country, about 200,000 of them are under the age of 65, which is a type of Alzheimer's called younger onset. So if we take them out of the equation, of that 5.2 million, 3.3 are women and 1.9 are men. So that's where you can kind of see that statistic sort of play out and what that looks like. In addition, you bring up, we know of two particular population groups that are at greater risk of the disease because of those populations' risk factors to things that we know increase the risk of Alzheimer's disease. So without making that sound too confusing, the African American and Hispanic Latino populations are inherently at greater risk for cardiovascular disease and diabetes. We know that cardiovascular disease and diabetes increase an individual's risk of developing Alzheimer's disease as they age. And so those two populations in particular, we see a higher incidence, but it's related to the risk factor rather than related to the ethnicity. And that's an important distinction to make. So we look at these two populations as being at much greater risk of diabetes and cardiovascular disease, which are what we call a modifiable risk factor, meaning you can modify your risk of diabetes and heart disease with diet, with exercise. You know, we talk about, or you've heard about, knowing your numbers, you know, your cholesterol and your weight and your blood pressure and those kinds of things. So we try to do a lot of education within those populations to make them aware of that so that they understand those risk factors. On the other hand, because we see more individuals, they also have a more significant need in some areas of the country in particular for service. They may have issues around access. There may be disparity issues because of socioeconomic factors. We could have a conversation just about that. But in and of itself, those are the two areas where we see more significant shifts in numbers.
So, you know, from I know you talked about cost. Is the U.S., I mean, is the government stepping up as far as the amount of dollars that's needed to help fight this disease?
In terms of research money, you mean?
Yes. Yes.
I would say in the last year, in particular, we've made some significant strides. Last year, there was an appropriation of $350 million, I believe, that went to the National Institute of Health for Alzheimer's disease research. It was a significant infusion of money. There's another $400 million that has gotten through committee this year that is potentially going to be appropriated. So that is great news, and that will take us to about, I'd say, give or take $1, around $1.4 billion I'm not terribly good at math.
Yeah.
But what we know, and that's great. I don't want to underscore that's a negative thing. But what we do know is that in order to make the strides that we've seen with HIV and AIDS, as an example, we need about $2 billion a year to actually have some sort of impact. And different researchers will tell you that time frame where that's required is anywhere from 5 to 10 years at a minimum. And that being said, yes, we're making strides, but not fast enough. My personal opinion, we needed that money yesterday, and we still need it yesterday. It's just not happening quickly enough. And so that whole idea of concern and awareness, education goes to the government level as well, because they also need to have an awareness that if we don't find a way to better manage this and or prevent or delay or whatever ends up happening first, there's going to be a huge cause and effect relationship to how that will impact Medicare, how that will impact insurance. You know, all of those social programs are going to be hugely impacted, as if they're not already, by the number of people that are going to need to access those dollars, and how long will that last?
Yeah, I mean, you mentioned insurance, and, I've been a big proponent of people getting long-term care insurance, but I'm hearing more and more of actually the insurance companies getting out of that part of the business. They're not all out of it, but more and more are out of it because they just see what's going to happen. They themselves may not be able to pay for what's going to happen in the future. So
yeah, and I've heard the same thing too, that companies other than the ones that are really big, and can support it, are eliminating that entire division from their organizations, because I think when long-term care insurance first was born, it wasn't trendy really right away. It was kind of a neat thing where if you had some extra money and you could afford it, it was a great thing to have. And now, as people are realizing, oh my gosh, what if, and if they actually do access the benefit, it can be incredibly expensive. The life expectancy for people with Alzheimer's disease can be anywhere from 3 to 20 years, and in some cases longer. So if you've got somebody that's accessing an insurance benefit for 20 plus years, that could be a little impactful for a company.
Right. Well, I could talk to you all day about this.
Yeah.
It's such an important subject matter, but we just got a minute left. Why don't you just take the time and tell people how to maybe get to your site or the Alzheimer's Association, the 800 number, how they can contribute, what they can do to help. Go ahead, and it's commercial time.
So I guess the things I would say would be, first of all, for people that are dealing with this in any way, shape, or form, you are not alone. And the Alzheimer's Association is there and ready and able to help you with whatever you might need. That 24/7 helpline, again, is 1-800-272-3900. Our website is alz.org. A couple of ways to get involved. One is this coming Monday on the longest day. It's one of our signature events where we honor those that are caregiving, where every day is the longest day, and we encourage people to do something that they love for sun up to sundown. It's the summer solstice on Monday, June 20th. So something to be aware of in your communities. And the other thing will be the Walk to End Alzheimer's Disease. This happens every fall. It is one of the, if not the largest fundraising event of its type in the country. The chapter that I'm a part of, our Twin Cities, so Minneapolis-St. Paul Walk, was the 4th largest walk in the country last year. So we're excited to try to get a little bit closer to number 1 this year, but it's a great way for people to get involved and take a walk with a whole bunch of people in purple to really emphasize the fact that they are not alone, and they can get information about walks in their community at alz.org as well, or by calling that 1-800 number.
Great. Debbie Richman with the Alzheimer's Association, thank you so much for joining us, and thank you for all that you do. You do some wonderful things to help others, and we'd love to have you back in the future. All right, and
I'd love to be back. Thank you so much for having me on today.
Great, and thank you all for tuning in. Just be safe out there, and we'll talk to you all soon.